morning, Mrs. Peanut. Welcome into the vet clinic. Tell me, what's going on?
Hey Doc, belly rubs haven't been feeling the same lately.
Well, I'm looking at your health history right now, and it looks pretty good. Do you mind if I take an ultrasound of your belly so I can get a better look?
You sure can. Anything you need to do to help me out, Doc.
Good news, Mrs. Peanut. It looks like you're pregnant with a litter of puppies. The ultrasound depicts about 5 to 6, but we won't be completely sure until you give birth.
Ruh-roh, how did this happen?
The reproductive process in humans and animals like you as a dog involve many hormones that each have their own role. Let's go over some terms and functions real quick. We start off with gonadotropin-releasing hormone, GnRH, which comes from the hypothalamus. The role of GnRH is to travel from the hypothalamus to the anterior pituitary gland to signal the release of FSH and LH. FSH is follicle-stimulating hormone, which, like I said, comes from the anterior pituitary gland, and the role of FSH is to begin follicle growth in your ovaries. After the follicles begin to grow, they start to produce estrogen, like I said, from the follicles in your ovaries. The role of estrogen is to help the uterus grow so it can be able to maintain pregnancy if the egg becomes fertilized. Along with estrogen, we have another hormone called inhibin, which comes from the follicles in your ovaries. The role of inhibin is to go back to your anterior pituitary gland and block the production of FSH. After estrogen and inhibin are being produced at steady levels, we get a rise in LH, like I mentioned earlier. LH is luteinizing hormone, which comes from the anterior pituitary. The role of LH is to cause ovulation to start. Once ovulation begins, the follicles rupture, which creates a mass of bloody cells called corpus luteum. The corpus luteum then begins to release progesterone. Like I said, progesterone comes from the corpus luteum, and the role of progesterone is to help secure the pregnancy. What it does is it goes back from the corpus luteum to your brain. It goes to the hypothalamus and it tells it to stop producing GnRH and also blocks the production of FSH. While it is blocking those two hormones, it makes sure that your LH production is still steady. If you, for some reason, if the egg for some reason does not become fertilized, a rise in prostaglandin from the uterus will be produced. What prostaglandin does is it makes the corpus luteum begin to disappear. It blocks progesterone, which is trying to secure the pregnancy. And then what it does is it tells those hormones like GnRH, FSH, and LH at the beginning of the reproductive process to begin to produce again. So you might have another chance at making puppies.
I'm still a little bit confused. Can you speak dog this time?
Good one, Mrs. Peanut. Of course I can go over again. Let's use this model for reference. Think of GnRH as the go button. The go button is hit in your hypothalamus, which causes GnRH to travel from there to the anterior pituitary. In the anterior pituitary, FSH and LH are produced. What FSH does is it causes the follicles to start to grow in your ovaries. Once the follicles begin to grow, they produce estrogen, which helps the uterus grow, and inhibin, which goes back to your anterior pituitary to block FSH production. After these two are being produced at steady levels, we introduce LH. What LH does is it causes ovulation to start. Once ovulation begins, the follicles in the ovaries rupture and creates a corpus luteum. The corpus luteum then produces another hormone called progesterone. Progesterone wants to secure this hopeful pregnancy, so it goes back to your hypothalamus to block GnRH production and back to your anterior pituitary to block FSH production, while also keeping LH at a steady level. If the egg does not become fertilized and you can no longer become pregnant this time, prostaglandin produced by the uterus is made, and what it does is it stops the production of progesterone so GnRH, FSH, and LH can be produced again.
Thank you for the lesson on reproductive hormones. I'm feeling like a pro.
Of course, anything I can do to help. And congratulations! Can't wait to see what those cuties look like in 2 to 3 months at the birth. Here, have some nutrients.
Look here. Look here.